CNA Test 14, Chapters 40, 41, and 42. A partial thickness wound caused by the scraping away or rubbing of the skin is an abrasion. A resident has an open wound on their lower left leg. It is caused by poor arterial blood flow. This wound is an arterial ulcer. Skin tears are caused by removing tape or adhesives. A patient has an open wound on her left foot. She has poor circulation in her arteries and veins. Her wound is a circulatory ulcer. Tissues are injured, but the skin is not broken. This is a closed wound. A wound has separated. Abdominal organs are protruding through the wound. This is an evisceration. A wound involves the skin, muscle, and bone. This is a full thickness wound. A condition in which there's death of tissue is gangrene. A wound has torn tissues and jagged edges. This is a laceration. The dermis and epidermis of the skin are broken. This is a partial thickness wound. Drainage that is thick, green, yellow, or brown is purulent drainage. Thin, watery, blood-tinged drainage is serosanguinous drainage. Bloody drainage is called sanguinous drainage. A resident has an open wound on the right lower leg. The person has poor blood flow through their veins. This is a stasis ulcer. A hematoma is swelling that contains blood. Skin tears are caused by direct pressure on the skin. To prevent skin tears, you need to keep your fingernails short and smooth and filed smoothly. Arterial ulcers usually occur on the toes and the outer side of the ankle. Common causes of arterial ulcers include diabetes. Circulatory ulcers occur on the legs and the feet. Which of the following is common with venous ulcers, and that is itching? A patient has venous ulcers. The person needs repositioning at least every 2 hours. What is a risk factor for venous ulcers? It is obesity. Which statement about diabetic foot ulcers is correct? They can affect the nerves and blood vessels. Which nutrient is needed for wound healing? And that is protein. When observing a wound, you can observe the surrounding skin. A drain is inserted into a wound. What is its purpose? It is for the drainage to leave the wound through the drain. What is the purpose of wound dressings? And that is to prevent microbes from entering into the wound. A dressing is loose. The drainage can escape. The nurse asks you to apply a dry, non-sterile dressing. What action is correct? You should remove the tape by pulling it towards the wound. The nurse asks you to apply a dry, non-sterile dressing. The dressing change causes pain and discomfort. What should you do? You should ask the nurse when a pain relief drug was given and wait 30 minutes to begin. Pressure injuries usually occur on over bony prominences. Which person has the least risk for a pressure injury? And this is the person that has the shortness of breath. Which of the following motions drags or rubs against the skin? And that is friction. Early signs of pressure injuries include tingling in the area. Patients who are bedfast are repositioned at least every 1 to 2 hours. The recommended position for preventing and treating pressure injuries is the 30-degree lateral position. To prevent pressure injuries, you must keep the patient's skin clean and dry. Pressure injuries can occur where the skin has contact with the skin. What can you use to prevent such contact? And that is pillows. To prevent pressure injuries, sitting in chairs needs to shift their positions every 15 minutes. A resident has a bed cradle on the bed. For linens, you need a draw sheet. Pressure injury prevention involves all of the following, which is identifying the patient at risk. What member of the healthcare team decides what dressing to use? And that is the nurse. A compress is a soft pad applied over a body area. To constrict means to narrow. To dilate means to expand or open wider. Cyanosis is a bluish color. Hypothermia means that the person's body temperature is very cold or very low. Heat and cold applications promote comfort. A nurse asks you to apply a heat application. Before doing so, you must make sure that that procedure is within your job description at the workplace. Heat applications do what of the following, and they decrease joint stiffness. When blood vessels constrict, blood flow decreases. When heat is applied, for older patients are at risk for burns. A person has a knee replacement. Heat applications are allowed except over the area of implant. Heat and cold applications are applied for 15 to 20 minutes only. Which of the following is an electrical device? And that's an aquatherma pad. A cool application is 65 to 80 degrees Fahrenheit. A warm application is 93 to 98 degrees Fahrenheit. The temperature of an aquatherma pad is usually 105. You are going to apply an aquatherma pad. You fill the heating unit with distilled water. Before applying an aquatherma pad, you need to put the pad in a cover. Cold has the following effect on the skin, and it is numbing. After applying a dry cold application, you need to check the application site every 5 minutes. And the last one, what measurements are needed when a cooling blanket or warming blanket are used, and that is vital signs. This is test 14, chapters 40, 41, and 42.